negotiate conditions of service. It is clear that you cannot negotiate conditions of service except you're a trade union. In fact, there are specific judgments of the appropriate arbitration or industrial courts in Nigeria. As far back as July 2011, the National Industrial Court, sitting in Enugu, had actually declared that it is only platforms that have colorations of trade unions or unionism that can negotiate conditions of service on behalf of their members.
Okay, let me...
So, in other words, I'm sorry.
Yeah.
In other words, to even say that government dialogues with enemy, it's an aberration. And it is the incentive for the recurrent crisis. Look at it this way. USU, you mentioned, is an agglomeration of 5 registered trade unions under existing acts of parliament. Under existing acts of parliament. So government has a responsibility to negotiate with such trade unions. I am president of the Pharmaceutical Society of Nigeria. I will not go on the table with government to agitate for the rights of pharmacists on the platform of the Pharmaceutical Society of Nigeria. Because pharmacists who are in government belong to a relevant trade union that takes up matters with regards to their condition of service.
So
PSN is not a trade union.
It's not a trade union. And government,
NMA is not a trade union.
NMA is also not a trade union. So from Medical and Dental Consultants Association to doctors who are in training, resident doctors, who are just student doctors, government has continued to violate relevant acts of parliament by negotiating with these people. And I think these are some of the fundamental problems in all of in the unfolding scenario in the healthcare sector.
Mr. Shotiloye, are you of the same opinion? You belong to NUAHP, which is a union, not a professional organization.
It is a union.
So, as a union, do you think that it is wrong for the government to negotiate with NMA or to even allow them have 24 commandments, as Mr. Akintaya said?
Absolutely. As you said, it is only a registered union that can sit down with its employers to negotiate conditions of service. Professional associations are supposed to just concern themselves with issues bordering on advancement of the profession. Mm-hmm. I'm happy the social commentator said, gave the example that if NMA wanted to push home its demand, they can use the Pengasan or Nupeng and so on. I'm sure they will not be able to do that because they are not registered as a union. As a matter of fact, the members of JUSU, the constituents of JUSU, the 5 unions, which includes my union, NOAP, NAM, that's the nurses, SATURAI, NASU, and
Medical and Health Workers
the Medical Health Workers Union. They are all members of either NLC
or
TUC. As a matter of fact, the NLC and TUC actually made a pronouncement to the federal government that they should look at the issues being agitated for by JUSU. Immediately they did that, NMA went to town and started saying all sorts about NLC and TUC, that they had bribed them and so on and so forth. So ordinarily, NMA going on strike is illegal, and if we have a government that wants to really be government, they should be dealt with accordingly.
Okay, let me just stay with you. Now, among the things that NMA is complaining about, because you said they should only concern themselves with matters relating to the profession, not to go into trade union activities. They have complained that the medical schools have no seats in their classrooms, and they even don't have test tubes in their laboratories. These kinds of issues, for instance, how would you recommend that they deal with them?
Well, let me first say one thing. The medical profession being the earliest instituted professions in the country, and especially in the health sector, they are blessed with people in policy formulating areas. They have their members as governors, they have their members as senators, they have their members as in the House of Representatives. And they have been using them in the past. So when they have issues bordering on professional advancement, when they have been using this, so the people I mentioned who are highly placed, they have been using them to get higher pay. They should also use them to reach out to the federal government to resolve all this kind of issues that you mentioned, professional issues. They can easily be done. So that instead of going on strike and making the poor man on the street suffer, there are other ways they can do that without necessarily going on strike.
Now, you are chairman of NUAHP.
Yes.
Then you have also mentioned Joesu. Do the doctors belong to any of these unions?
They can't be because
They
they are
can't.
not even registered as a union.
No, that's what I'm saying. So, since they don't have their own particular union,
Yeah.
can they be members of these other unions?
They can. First thing they will need to do, they will need to get registered with the labor center in the country, Ministry of Labor. The registrar of trade unions will register them, either with TUC or NLC as the case may be, but I'm sure it's TUC they will be registered under. That's the first thing. So when they are registered as a trade union, then they can become a member of the joint health sector unions. As a matter of fact, we had made several offers to them to go and register and then come and sit down with us. Let's negotiate. And let me say one thing again, that I'm not surprised that you invited NME and they are not here, because one of the major things we have been advocating for is a roundtable discussion, a stakeholders conference. Let us all sit down and fashion out a way of moving the health system in Nigeria forward. But they are always dodging for that. It's not the first time. I won't be surprised if you call them tomorrow when they know that we will not be here, the other health professionals will not be here. They will come. But when it comes to sitting down together, let's talk. And that's part of the problem we are always talking about. Undue arrogance, over bloated ego.
Okay. Sorry, Alero. I think it's also very important because you asked the question that one of the conditionalities is they don't have test tubes, medical schools are poorly equipped and all of that. I gave a background, that situational analysis. I talked about 54 federal health institutions. Now that includes all the teaching hospitals where they train these students. On those boards, you have provosts of colleges of medicine. You have representative of VCs. You have at least, go check it out, at least 8 medical doctors are on each of those boards. At least 8. There are some that you have 10, 11.
So what are they doing?
So you want to ask them, take it back to them. So, because it is the boards of management that appropriates all the resources to these medical schools. And you go and conduct further checks. I told you the federal ministry is dominated by 2 federal ministers who are doctors. Out of 10 directors who constitute the top management committee of the Federal Ministry of Health, at least 7 are also medical doctors. So in terms of policy designs and plans, everything in the health sector is actually dictated and driven by these guys. So why are they complaining? It is because rather than dedicate these resources to vital areas like training, research and development, all the resources are dedicated to payment of salaries of people who do not work.
Who are the people who don't work?
I told you that Nigeria has a plethora of 10,863 honorary and hospital-based consultants who are medical doctors. It comes with huge, huge resources. Today, part of the conditions doctors are giving the government, I told you all the CMDs are doctors, the chairman medical advisory committees are doctors. Illegally and unlawfully, they have created the position of deputy CMAC, deputy chairman medical advisory committee. In some of the hospitals, they have as many as 6 deputy CMACs who are also doctors. Now, these are university lecturers who have been brought into the hospital system to render administrative duties with a full paraphernalia official structure, official card.